High blood pressure is a common condition. It happens when the force of blood against artery walls is too high. Doctors call it hypertension. It can lead to serious health problems. Most people with high blood pressure do not have symptoms. High blood pressure can damage your heart. It can also harm your blood vessels. This makes your heart work harder. Over time, this can lead to heart disease. It can also cause strokes. Knowing your blood pressure numbers is crucial. Normal blood pressure is below 120 over 80 millimeters of mercury. High blood pressure is 140 over 90 millimeters of mercury or higher. Keeping track of these numbers can save your life. Many factors can cause high blood pressure. One major factor is diet. Eating too much salt can raise your blood pressure. Foods high in fat and sugar can also be harmful. Lack of exercise is another cause. Your heart is a muscle. It needs regular activity to stay healthy. Without exercise, your heart has to work harder. This can lead to high blood pressure. Stress is a common cause too. When you are stressed, your body produces hormones. These hormones can increase your blood pressure. Over time, stress can lead to long-term high blood pressure. Finally, genetics can play a role. If your parents have high blood pressure, you are more likely to have it too. It is important to know your family history. This can help you take steps to prevent high blood pressure. High blood pressure, also known as hypertension, can lead to serious health problems if not managed properly. One major risk associated with high blood pressure is heart disease. This includes life-threatening conditions such as heart attacks and heart failure. High blood pressure forces your heart to work much harder than it should. Over time, this excessive strain can weaken your heart. Another significant risk is stroke. High blood pressure can cause damage to the arteries in your brain. This damage can lead to arteries bursting or becoming blocked. Both of these situations can result in a stroke, which is a medical emergency. Strokes can cause severe brain damage, long-term disability, or even death. Another critical risk of high blood pressure is kidney damage. Your kidneys are responsible for filtering waste from your blood. High blood pressure can damage the delicate blood vessels in your kidneys. This damage makes it difficult for your kidneys to function properly. Over time, this can lead to chronic kidney disease or even kidney failure. High blood pressure can also have a detrimental effect on your vision. It can damage the tiny blood vessels in your eyes, leading to various issues. This damage can cause bleeding, swelling, or other complications. If left untreated, it can eventually lead to severe vision loss or even blindness. Heart disease and stroke are two of the most serious risks of high blood pressure. These conditions can have devastating effects on your health and quality of life. Heart disease occurs when your heart cannot pump blood effectively, leading to a range of complications. High blood pressure forces your heart to work harder than it should, putting extra strain on this vital organ. Over time, this increased workload can weaken your heart, eventually leading to heart failure if not managed properly. A heart attack is another severe form of heart disease. It occurs when the blood flow to a part of the heart is suddenly blocked. This blockage prevents oxygen-rich blood from reaching that part of the heart, causing damage. High blood pressure can cause this blockage by contributing to the buildup of plaque in the arteries. A heart attack can damage or destroy part of the heart muscle, leading to serious health consequences. This can be fatal if not treated quickly and effectively by medical professionals. Stroke is also a major risk associated with high blood pressure. It can have equally devastating effects. A stroke occurs when blood flow to the brain is interrupted, depriving brain cells of oxygen. High blood pressure can cause the arteries in your brain to narrow or even burst, leading to a stroke. This interruption in blood flow can lead to significant brain damage or even death. Strokes can cause permanent brain damage, affecting speech, movement, and other critical functions. Both heart disease and stroke are life-threatening conditions that require immediate medical attention. Quick response and treatment are crucial to improving outcomes and saving lives. Managing your blood pressure through medication, diet, and lifestyle changes can help prevent these serious conditions and improve your overall health. Section 5. Real-life examples. There are many real-life examples of the dangers of high blood pressure. Take John, for example. He was a 45-year-old man with a busy job, always on the go. He did not watch his diet or exercise, often opting for fast food. He often felt tired but ignored it, thinking it was just part of his hectic lifestyle. One day, he had a heart attack, a wake-up call he never expected. His high blood pressure was a major factor. Another example is Maria, a 60-year-old woman. She enjoyed a salty diet, often adding extra salt to her meals. She did not know she had high blood pressure, as she rarely visited the doctor. One morning, she had a stroke, a sudden and devastating event. The stroke left her with lasting brain damage, affecting her quality of life. She now needs help with daily tasks, relying on a caregiver. Then there is Paul, a 50-year-old with a family history of high blood pressure. He ignored his doctor's advice to get checked, thinking he was invincible. He ended up with kidney failure, a consequence of his neglect. Now he needs dialysis several times a week, a life-altering routine. These stories show how important it is to manage blood pressure and take it seriously. Simple changes, like exercising and eating healthy, can make a big difference. Regular checkups can catch problems early, potentially saving lives. Section 6. Prevention tips. Preventing high blood pressure is possible. One way is through a healthy diet. Eat plenty of fruits and vegetables. Avoid foods high in salt, sugar, and fat. Drinking water instead of sugary drinks also helps. Exercise is crucial. Aim for at least 30 minutes of activity most days. This can be walking, jogging, or even dancing. Exercise helps keep your heart strong. It also helps you maintain a healthy weight. Managing stress is also important. Find ways to relax. This can be through hobbies, meditation, or spending time with loved ones. Reducing stress can lower your blood pressure. Finally, avoid smoking and limit alcohol. Both can raise your blood pressure. If you smoke, seek help to quit. If you drink, do so in moderation. These steps can help keep your blood pressure in check. Section 7. Managing blood pressure. If you have high blood pressure, managing it is key. First, monitor your blood pressure regularly. You can do this at home with a monitor. Write down your readings to share with your doctor. Take your medication as prescribed. Skipping doses can make your blood pressure rise. Follow your doctor's advice on lifestyle changes. This includes diet, exercise, and stress management. Regular checkups are important. Your doctor can adjust your treatment plan if needed. They can also check for any complications. Early detection can prevent serious health issues. Support from family and friends can help. They can encourage you to stick to your treatment plan. Together, you can manage high blood pressure effectively. High blood pressure is a serious health concern. It can lead to heart disease, stroke, and other complications. Knowing the causes and risks is important. Real-life examples show the impact of unmanaged blood pressure. Prevention and management are key. A healthy diet, regular exercise, and stress management can help. Avoiding smoking and limiting alcohol are also crucial. Monitoring your blood pressure and following your doctor's advice can prevent serious health issues. Managing high blood pressure is a lifelong commitment. Simple changes can make a big difference. By taking steps to control your blood pressure, you can protect your health and improve your quality of life.